But if we can prevent individuals from getting there, which I feel I could have been prevented of getting to that stage if only I knew more about the disease, if I was educated, if my physicians educated me regarding the disease, if they actually did a complete blood panel and a kidney panel once a year. So, this may be a policy we need to implement,
Mm-hmm.
on your wellness check, have a kidney panel, and that would detect where your kidney function stands. And if those things were implemented, I would not be, number one, have gone through dialysis, and number two, even having a transplant. And so my story is something that mirrors many people. This could be genetic for a lot of people, it could be injury, it could be diet, and it could be also from other pre-existing medical conditions. No matter what it is, the end result is the same. It's
Mm-hmm.
dialysis and transplant if you're lucky.
If you're lucky. And what you just said about your physicians, I want to go back to that because that seems to be where the rub is is that with your with physicians, we've got to tell people what's going on with their kidneys in a timely manner. It's not happening. Like there's data that says that we're testing kidneys and that we're doing the blood panels and urinalysis, but somewhere along the way the breakdown is not, it's not getting to the patient. It's not being, the information isn't being translated to the patient. Was that the case with you to some degree?
Oh, that was absolutely the case. I mean, there was not even talk about kidney function. There was, I mean, one of the other effects of kidney, a very common sign of kidney disease is your high blood pressure.
Mm-hmm.
I was very athletic. I played racquetball I mean, 3 times a week. I was slim. Um, I mean, there was no indicator, even through genetics, through my family, of why I had high blood pressure. They
Mm-hmm.
put me on many high blood pressure tablets, and even those did not work. Now, I wasn't at a level where I am now, where I can diagnose myself on what it is. I was a
Mm-hmm.
student. And
Mm-hmm.
so I depended on my physician, and my physician could have identified, hey, high blood pressure, but this individual has absolutely no reason to have high blood pressure. Could it be kidney? And they could
Mm-hmm.
have done a kidney function test. That never occurred. The word kidney never ever came up in any conversation. Yet on the silent side, I was going through kidney failure, but the symptoms were there and that was not noticed. And so, even if we have on a wellness check once a year for every patient to get a kidney panel, at least that would alert a physician to say, hey, this person's creatinine is up. Let's do further testing. But none of
Exactly.
that ever happened.
Exactly. Something as simple as an inexpensive creatinine test could
Right.
save anyone's kidneys. It's far better to have that simple test done than to end up in end stage renal disease with an $88,000 a year bill and your quality of life completely decimated.
So let me remind you real quickly about the $88,000 bill. Again,
That's on the
that
low
depends,
end.
that depends on what type of medical insurance you have. Um, my bill for a year was hitting maybe $2 million, and
Wow.
and so you can calculate this very easy. It was about 18 to 20,000 per session. You have 3 sessions per week, and so count per week, per month, per year, and that number really escalates.
Wow.
So So I was actually paying, my insurance was paying almost $50,000 to $60,000 on dialysis per week.
That doesn't even seem real, but I know that it is. It's
Yeah.
just
Yeah.
that's an astronomical number.
Yeah. So we need to be very vigilant of the cost to the community when we're looking at someone going in dialysis. And it's not just that, it's not the monetary value of that cost.
It's the human value.
Emotion,
Mm-hmm.
the emotional, the family, the siblings, the individual's work. I mean, there is so much that needs to be taken into account. And when you bring all those factors together, there's no monetary value you can put to it.
You're exactly right. And Dr. Mangla, we're going to have to leave it there. I thank you for taking your time to talk with us and for sharing what Texas Kidney Foundation is doing and what our next steps are to help our community. And I thank you for all the service that you're giving to the United States. And I look forward to what our next steps will be with this incoming administration and a singular focus on mitigating this pandemic.
Tiffany, thank you very much for your time. It's been a pleasure. It's always a pleasure having an interview with you. And again, there is one goal, and the goal is to support, educate, and ensure that none of our chronic kidney disease patients really go through dialysis or transplants. And if we can help it, we will avoid them getting to that.
Thank you so much, and you have a wonderful day.